And you are the author of the Women's Intervention Nutrition Study, a very interesting study where you actually tried to intervene with diet among women who had breast cancer. What did you do, in fact?
Yeah, so these were 2,437 largely postmenopausal women with early stage resected breast cancer. Since they were recruited between 1994 and 2001, they received standard therapy, so hormone therapy if receptor positive, chemotherapy if receptor negative, appropriate radiation therapy, but this therapy so it'd be therapy from 20 years ago. But that's standard therapy. The randomization was to a lifestyle intervention targeting dietary fat intake. We achieved that. We also got a 6-pound weight loss, which is both statistically significant, different than the control population. Intervention for 5 years, had 24% fewer recurrences. Funding ended, okay? And so now, after all these years, really it's over a decade, we're able to do a death registry follow-up.
Right, because it's 20 years and you've now got what's called the final survival analysis, because some of your women sadly have died, but you've got statistics on this. Now, what did you come up with exactly? You were giving me some of the numbers just there, but in detail, what did you have?
Sure, and I should emphasize this is death registry follow-up, so we're really only able to find, unfortunately, the dead participants. But with that, so we look at overall survival in the overall population. There were 17% of the women had died in the control, 13.6% in the intervention, but that difference was not statistically significant. However, in the receptor negative, estrogen receptor negative population, there was a 36% improvement in overall survival, approaching 2 years of additional survival. And in even more interesting, and I think exciting from a biological standpoint, in the estrogen receptor negative, progesterone receptor negative population, we didn't have HER2 status, but SEER data registry will tell us that 73% of those patients were triple negative, would be triple negative. So the population, largely triple negative, had a 54% improvement in overall survival, 2.3 years median survival increase.
Well, it's beginning, from what you say, to seem as if dietary intervention could be one of the arms of therapy.
Yeah, I think this is this study, which was negative overall, but with these very, very interesting exploratory subgroup analysis, really points to a need for confirming studies, perhaps especially in the estrogen receptor negative population. You know, in triple negative, we've really been stuck for about 10 or 15 years in terms of, breakthrough therapies.
But you've got survival advantage in the group overall.
No, not overall. Overall, there were fewer deaths, but that was not statistically significant. Now, one of the problems with these long-term survival things is people start to die of many other things, and we couldn't separate out cause of death in our analysis.
What then can you definitely say about reducing fat in the diet among your patients being treated for breast cancer?
Yeah, I think so. Right now, we're in a situation where if this was an expensive new drug, you would need for sure confirmatory studies before you could do anything, because of the toxicity or the cost. Here we have a different situation. We have a signal for the scientists, for breast scientists, other breast scientists to work out. But for a woman with breast cancer, we know there's benefits from this modest 6-pound weight loss. Huge epidemic of diabetes. This can be reduced, progression of diabetes reduced by just doing this. So a woman could look at this and say, I know there's benefits from doing this, maintaining my weight or reducing weight other than breast cancer. Oh, and by the way, it may keep me from dying of breast cancer as well, which we can't be sure of. So I think it's a reasonable thing to say, why don't you go a little bit that extra, quarter mile and try this intervention, as the scientific details get worked out.
And I'm tempted to ask, if you got a weight loss, were you chasing the right culprit with fat? Should it perhaps have been better to chase calories?
Sure. So this is the usual 20-year hindsight, right? So when we designed the trial, fat was the target. And the studies at that time didn't even want us to achieve weight loss because they thought it would muddy the waters. But now, after 20 years, more consistent data for weight loss, weight maintenance, increased physical activity, which we had no idea about before. So now the interventions that would be ongoing would be weight loss, weight maintenance, and increased physical activity. So I think if a woman wants to consider something, that's what she should consider. And if she has the other favored way of getting to weight loss, we don't have any evidence to say that that would be worse.
You've got a lot of experience on the factors involved here.
Yeah.
So what are your prudent recommendations to doctors for treating their patients as far as diet is concerned? And, of course, let's face it, activity.
Yeah, so I think the observational data coupled with our results suggests that weight loss, weight maintenance can be important for overall health and, in quotes, may reduce chance of dying of breast cancer. I think increased physical activity, there's lots of observational study data that it may even reduce recurrence risk. There's a couple smaller trials that are ongoing, randomized trials looking at weight loss, increased physical activity, centrally mediated. I think that's going to be the future. That's going to be the future in terms of, instead of having this one-on-one contact with a centrally mediated telephone intervention, internet intervention, it should be more easily achievable. And then the question is whether the physician should maybe engage this, but a woman can engage this herself. I mean, in terms of saying, this is healthful, and by the way, I'm in a higher risk category that might have additional benefits from doing these healthful things.
So could you distill in just a few seconds your current recommendations then in a couple of sentences for women with early breast cancer? What should they be doing ideally?
So if they're not obese, they should maintain their weight, which can be some issue with our therapies. If they're overweight or obese, target just 5% weight loss. Increase their physical activity to kind of regular walking about 3 hours a week. And that, it looks like observational study plus with this trial result suggests that will have other health benefits and may reduce a bad outcome from breast cancer.
And one thing I think you suggested is get yourself a dog.
Oh, yes. I think the other approach that I had suggested at an international meeting was that, as opposed to some of our expensive new therapies, that every breast cancer diagnosed patient should be handed by our oncologist a Labrador Retriever puppy. And by the time she was through with her adjuvant chemotherapy, the dog would be available for walking. There's great evidence that dog owners are more likely to achieve physical activity guidelines than non-dog owners. So I think that would be a reasonable thing. Acquisition costs $500, maintenance costs $1 a day for dog food. You can't beat that compared to our new therapies.